We have a lot to talk about, guys. I have been doing my homework on my own as well, just studying this incredible restorative and medical tattooing artistry of what can be done for anyone who's facing a reconstruction, mastectomy, or I would say maybe just in general, you know, just the artistry of itself. Is that correct? That it doesn't have to be just someone going through a mastectomy. Is that true?
Well, there are other situations where someone might want restorative tattooing. For example, if they've had a breast lift surgery and lost pigment in their areola, we can definitely add pigmentation to the areola.
Okay, great. Well, let me introduce both of you so that anyone who's joining, they know who you are and what you do and why we are here together. So, Marnie, if you don't mind.
Yes, I am Marnie Rustemeyer, and I'm the restorative tattoo artist at Nipple Plastic Surgery. I've been here for about a year, but I've been practicing for almost 7.
Great. And Dr. Light?
I'm Dr. David Light. I'm one of the partners at NIBRA. There's 5 of us. We all specialize in breast reconstruction. And we were fortunate enough to bring Marnie on to put the final touches our reconstructions, which makes a huge impact. And tonight is mostly about Marnie. I'm just going to give my 2 cents on the how important it is for women to have this option. If they don't have the option near them, there are tattoo artists, not only Marnie but around the country, and women should be aware of this and should know that option, because it really can enhance a already beautiful reconstruction and make it so much better.
I'm really glad you said that, because it is an honor and a privilege to be working with both of you, because as a survivor myself who went through this journey, I didn't know of all of the things that you two do every day, all the wonderful procedures that you are doing to help women feel, I don't even want to use the word whole, but just offering these options. And so I'm honored to have both of you be part of Learn Look Locate. Both of you are advisors on this panel of experts that are part of my global mission, because we don't know about this. I mean, I wonder if I could have anyone raise their hand. It's hard because you can't see everyone. How many people actually know about not only restorative and medical tattooing, but microneedling and scar camouflage and deep flap reconstruction and TUG reconstruction? I can't even say them all, but there's just a lot we don't know. So all these conversations are going to be here forever, and I'm going to edit them so they get out all over the place so that more and more people globally, as much as I can, let people know. So I want to start really quick with Dr. Light, being a plastic surgeon. When a woman is diagnosed with breast cancer and all these options are coming her way as far as breast reconstruction, and hopefully she is educated on all the options available to them, is it a plastic surgeon's as part of what they present to a woman facing a mastectomy to mention this beautiful option as part of their reconstruction? I mean, I know NIBRA is quite special, but from your perspective, and then we'll weave into Marnie, but I do want to understand, you understand the question?
Yeah, I think the way that the tattoos usually come up is, during the consultation, we're trying to figure out what type of mastectomy. Is there a little bit of a reverb?
I hear that.
Is that me? Hold on, let me lower my volume. Is that better?
Let's try. Yeah, it sounds better.
Okay.
So, where the patient comes, where they've already seen the breast surgeon, so we're trying to learn what type of mastectomy they're going to have, and meaning a nipple sparing or a skin sparing, and the decision on whether to have a nipple sparing, one of it is a safety decision. So we have to, the breast surgeon decides, usually based on an MRI, if it's safe to preserve the nipple, is the tumor far enough away. And then the plastic surgeon also weighs in on whether the nipple is in a correct position, so an aesthetic position, in order to enhance the reconstruction. Because at the end of the day, the nipple isn't going to quite function as a normal nipple does. we can do resensation procedures in order to improve the sensation of the nipple, but without that, the nipple doesn't have very much sensation afterwards. And so it's really a cosmetic enhancement to preserve the nipple. So if the patient realizes or during the discussion it comes to light that they're not going to save the nipple, that's when the nipple option for a nipple reconstruction comes up, and option for restorative tattooing comes up. And it's the discussion is started there, but it's really finalized after their initial procedure, because it's the nipple reconstruction and the tattoo doesn't happen on the day of the DIEP flap or the implant reconstruction. And so there's usually a little bit of time, but it's definitely important to start that conversation, show pictures, and educate patients so that they understand, and it gives them a little bit of hope that, okay, I saw a picture, the nipple reconstruction, the tattoo looks great. I have options moving forward. I may not have to decide about it right now, but I'm not too disappointed that there isn't an option for me, down the road.
Question for both of you. What percentage do you think of women have no idea that this is even available to them? Do you have any idea?
I don't know what percentage, but it really has started to be more known through social media.
Okay.
I think that many years ago, patients only felt like their surgeon was the only one that could do it, or maybe a handful of other artists. But now it's really become a specialized field, and more artists are getting trained to do this kind of work, and more patients are looking at it as an option after their mastectomy.
Yeah,
it's wonderful.
When I went into practice, we were doing the tattoos ourselves, and we did an okay job. But when we realized what a trained artist can do, it really is above and beyond what we were doing, and so it really enhanced it. And I would say that the number of, and Marnie, you let me know your thoughts on this as well. The number of 3D tattoos alone without a nipple reconstruction, I think, have gone up, because patients see that the tattoo alone is great. I don't necessarily want to feel the nipple protruding through the clothing, and so I think the last 5 years, I've had more patients that went with the tattoo alone, knowing that it's a great option, than before. Some women still absolutely want to have a nipple reconstruction, but they're, I think, more and more opting to just move forward with the tattoo.
Yeah, sure.
Well, this is great. So I have some questions here, and we have an active crowd here, so I'm excited to dive into some of these questions. If you guys want to jump in on any of these first, or would you rather me? I think maybe I'll start with some of the ones that Marnie and I have worked on together here.
Ask away.
So we've got, what is the most asked question that you get about nipple tattooing?
Well, the number one question that I get when I'm doing the consultation is, does it hurt? And typically the patient doesn't have any or minimal feeling after they've had the reconstructive surgery.
Okay.
So there isn't a lot of pain. If they do have feeling, I tend to work with a topical anesthetic regardless, and it takes any sort of pin-pricky sensation away. If they're extremely sensitive and they can feel everything, sometimes we do some like a lidocaine injection to just nip it in the butt, and they don't feel a thing. But it's really tolerable. It's not extremely painful, and most people fall asleep during their tattoo session.
Okay.
I make them very comfortable.
That's nice. So what is the best way, Marnie, for someone to find a nipple tattoo artist in their area? Because, we want to make sure they find the right, medically trained, correct?
Sure. Yeah, absolutely. There's some resources available through social media. A lot of artists are getting trained with different schools that can reach out to their surgeons and hopefully give them their information, and the surgeons can recommend them to the artist. But I feel like there's a lot of groups on Facebook as well. There's the DIEP flap groups, and there's different mastectomy groups where people share their artist information. So word of mouth is probably the biggest way people are finding an artist in their area, and not only in the United States, but worldwide. I trained with artists in the UK as well, and they're really working hard at raising awareness with a lot of the cancer centers to get the patients to see these trained artists.
This is wonderful. Do these tattoos fade? They
can. Now, historically, the tattoos that were used by the medical professionals were made with cosmetic pigment, and cosmetic pigment is meant to fade because it is for the face, and it's meant to soften over time and fade out so we can make any adjustments down the road. I use a very high quality body art pigment that is meant to last. I do layer the tattoos over 2 stages. So the first stage is a bit lighter, and it will fade a little bit. The second, but everybody's different. Everybody's skin type is different. Everybody has a different, they have different stretch marks, they have different scarring. Some people have amazing skin. I've had people come back for their second session and really didn't have to do a whole lot. Maybe just a few minor, details that took about 30 minutes. But then I've had other people come back to their second session and they had a lot of fading just because of the level of the skin that was compromised that I'm working on. So everybody's different. And I always like to see them come back for that second session. So I have the opportunity to make any adjustments that need to be made, whether it's reinforcing pigment that might have faded or adding any additional detail to the tattoo.
So how long after surgery can someone get a tattoo?
Well, I like to say 4 to 6 months. And that's because in 4 to 6 months, everything is typically really healed. The breasts are in a good, position, probably the position that they're going to be in for a while, I hope. And that means the tattoos will be in that position that we initially place them in. Now, sometimes things happen down the road, and they might need a little additional surgeries, like a fat grafting here or there, or sometimes they may go back into treatment, and things change. But if that happens, then I will do my best to make any adjustments that need to be made.
So someone could have, I've been a couple of years out, and if I decided, now, anyone can do it, after the 6 months at any time, correct?
Well, I would have to see what you look like at the consultation and make sure your skin is intact and healthy enough to tattoo.
Okay, so it has a lot to do with the skin as well. How does your technique differ from others, Marnie?
Well, I think we all have pretty much had the same fundamental training as far as the needle selection and the pigment selection and the general artistry, but it all depends on you and your artistry and how you approach the tattoo yourself. I think it's important for the patient to look at everybody. They look at several portfolios just like they do for a surgeon, and they find somebody's style that they like and that they feel comfortable with in their consultation.
So here's the big question. Does medical insurance cover restorative and medical tattooing?
In 1998, the Women's Health and Cancer Rights Act was enacted, and that's a federal law that requires insurance companies to cover everything from the mastectomy to the reconstruction all the way to the tattoos.
Really?
Yeah, it sounds great. That's
there's a but.
But it's tough dealing with insurance companies sometimes and getting that reimbursement. But it is a federal law. Every insurance company is different. For people that don't have insurance, I do work with some organizations that provide grant funding, like the Heirs Foundation, and we can certainly help the patient fill out an application to proceed with the grant funding to get the tattoos.
Do you want to add anything, Dr. Light, to any of these questions? Because I'm going to move on to some more here.
No.
Nope.
Mark,
okay. Can you create a nipple areola on someone who has decided to go flat?
I actually have done that before. It was a unilateral, and she was flat on one side. She decided not to have reconstruction, but she just wanted a nipple on that side. So absolutely, I can put a nipple anywhere you want it.
That's awesome. Can you select the color and size in advance, and do you give your recommendation, and how does the process work, Marty?
So during the consultation, I will discuss the entire process. When you come in for your tattoo, your first session of tattoos, I do some measuring, some color matching. I'll put some swatches on your chest so you can see, you know, a color that might work for you. Now, keep in mind, you know, your skin's been operated on, and you might have tissue from your abdomen and your breast, which is totally different than it was before. So while it's helpful for somebody to come in with a picture of what they looked like before, sometimes your breast is now a slightly different color than it was. So, and it's a different texture. Like, you know, usually it's kind of fair on your chest, and sometimes it's a little thicker skin and a little darker on your stomach. But, you know, all of these things we take into consideration when we're discussing the color, and we'll pick one that matches your new skin tone and your new breast size and shape. And I'll have you look in the mirror. You can tell me if you like the size and the shape and the color, and then we'll proceed with the tattooing from there. So it's sort of like a team effort.
I like it. That's really
a lot of times the position for the tattoo has already been sort of predetermined as well, depending on the type of reconstruction they had. So if it was a skin sparing mastectomy and a deep flap, the circle of skin you know, is already present, which will become the reconstructed areola. And if the nipple reconstruction has already been performed, then obviously the areola is going to be positioned around that nipple reconstruction. So sometimes there's a flat canvas that Marnie has to work with, where there's no nipple reconstruction and just a smooth breast, and other times there's a setup with the nipple reconstruction already there. Her canvas can change too. I'm sure, Marty, it's different for you to tattoo pap flap skin from the thigh, which tends to be a little bit thinner, versus a deep flap skin paddle, which tends to be a little thicker. And probably the thickest of all would be, although we don't perform them very often, is a latissimus flap, because the back skin is very thick. And so I would imagine that your technique and maybe even the number of passes that are required to get the pigment into the skin adequately, you know, changes depending on the reconstruction.
Yeah, absolutely. And it also depends on if the skin's been radiated. So on somebody with radiated skin, it's typically a lot tougher.
How many, I'm going to sidebar here a second. There are a lot of restorative and medical tattoo artists that are living outside of the plastic surgery space on their own. You know, you work in tandem so nicely with the plastic surgeons. So is that typical? I mean, for me, I feel like, well, that's just the way it is. But do the medical and restorative tattoo artists kind of, you know, live on their, you know, kind of practice out on their own, or are they all associated with plastic surgeons? And with that question, you know, the knowledge that Dr. Light just brought to the forefront about the different types of reconstruction to help guide and go along with the skin and all of that, I think is really important. So just curious.
I mean, I can't speak to how many artists there are that are working with surgeons. I know that I know a few who are, and I think fantastic in New York and New Jersey.
Okay.
I know some in my, you know, in this area, but as far as other states, I'm not really, you know, with.
So it is typical to have, you know, restorative and medical tattoo artists on their own. It you know, it could be either or, correct? It's not.
Yeah, most of them, they'll go to a different office and work.
So I bring that up, you guys, because I was treated at a major cancer center, and a major cancer center is not going to bring this up. So that's why it's really important, these open conversations about what really is available. I mean, even deep flap, Dr. Light, I didn't even know what that was until a year later a friend of mine told me. So
yeah, I mean, I think that we are, you know, we're fortunate that you know, we found Marnie, and she was sort of in our vicinity and was able to come and join us in our office. know, I've certainly trained in places where there weren't medical tattoo artists. So, you know, I think you just have to be fortunate enough if they're in your backyard, and if not, you know, do your research, find someone. You know, it may be 1 or 2 trips, but it may be worth it to travel to have a quality tattoo, because if you see the photos, the results are really quite impressive. And you know, I always tell my patients, you're going to have your reconstruction for years. We got to take every step to do it in a safe and reliable way to get you the best results. And if that means getting a great tattoo at the end to really, you know, polish things off and really have it look like a breast. I mean, it's really quite remarkable whether it's flat or there's a nipple reconstruction there. I think it's well worth it.
And likewise, people travel to NIBRA from all over the world and the country to have surgeries and to even have their tattoos. So we're lucky to be here, and I'm really happy to be here as well.
That's awesome. I do have another question about the difference between restorative tattooing and cosmetic tattooing.
Oh, okay, cool. So and they actually can go hand in hand, because sometimes if I'm doing like an eyebrow or a lip tattoo, somebody's had an injury. I posted a really great video a year or so ago of a girl who was attacked by a dog and her lip was mangled and she had a big scar. And so I tattooed it. I scar camouflage and lip blush. So lip blush is a cosmetic tattoo procedure, but the scar camouflage portion was the restorative part of the procedure. So it's really remarkable how those two lines can cross. But if it's just pure cosmetic, it's usually lips, brows, eyeliner. Restorative is bringing back something that was lost. Trauma or injury or surgery, or even an autoimmune disorder like vitiligo, where we can camouflage that. So cosmetic tattooing, also I use different pigments for cosmetic tattooing. It's meant to soften and fade over time, whereas restorative tattooing on the body, I use bodyguard pigment. That's meant to last.
Thank you so much for that. 2 more questions, because I know you're a little tight on time here. Microneedling is a big part of, and I want to call out the page on the website that Marty was so kind to work with Learn, Look, Locate, and bring all of this information on the website. It's under the reconstruction, educate, under breast reconstruction. Is a complete deep dive, thanks to Marty and Nibra for really educating us, and beyond honored to have this information available, and actually in such a pretty way, don't you think, Marty?
Beautiful.
Yeah, and on there is, and again, never heard of all of this, microneedling and scar camouflage. So if we could just, you know, touch on that, and then I'll let you lovely people go, because I know it's late on the East Coast.
So microneedling is basically a controlled injury to a scar, for example, to help stimulate collagen production and bring elastin to the surface, helping to flatten and soften the scar, and also helps with hyperpigmentation in a lot of situations. I just posted one, I think yesterday, of upper lip scar that I did microneedling on one session, and you can see a huge difference as far as the way the scar is really healed and flattened. And you know, it's a great modality for scar management. I love microneedling for stretch marks, scars. Oftentimes, when a patient does have a deep flap reconstruction and there is abdominal tissue on the breast, there are stretch marks as well, and the microneedling can help eliminate the soft.
Oh, that's so interesting.
Or I do the tattooing, and it'll result in a better overall outcome. And it can be, other things can be added to the microneedling, like silicone gel adhesive strips, lightening serums for darker skin types that may have dark hyperpigmented scars. I like some with either vitamin C or kojic acid, and sometimes even recommend doing the serum 7 days prior to prevent further hyperpigmentation.
Wow. So. We do have a few questions. Do you guys have time for some of the questions here, or no?
Sure.
Okay. I'm going to put my glasses on unless you guys can see them better. Somebody is asking, when would you use microneedling versus laser?
I've seen good results with one laser session, but the people that have come to me for microneedling typically say, yeah, I had, a couple of laser sessions. After one, I saw that it was a little lighter, but it really wasn't as flat as I liked. So they try the microneedling, and that tends to help it along a little bit more. So I certainly think they can be used in combination with each other.
I think it also depends. It depends on the laser that you're using. A lot of times, fractionated lasers are used for scars, and it depends on the scar, the thickness, and sort of how much and what your expectations are. So I think microneedling, Marnie, you probably do a few sessions. Sometimes with a fractionated laser, you have to do a few sessions as well. I think for not a scar that is extremely thick, then you may fall back to the laser. But for your average scar that you're just a little bit unhappy with and it's just a little bit thicker, then microneedling is a great place to start.
Mm-hmm. This is good, really helpful. Someone is asking, I don't know if you answered this already, but if someone had DIEP flap and wants a 3D tattoo, I guess, is that possible?
Yeah, absolutely.
Okay. And then someone is asking me,
nipple reconstruction or no nipple reconstruction, doesn't matter. The scar patterns. I mean, you can. Marnie has put tattoos on just almost every shape and size and approach. So it's certainly possible.
Okay. And then I'm not sure what they're referring to, but is that something that insurance covers, or is it private pay? And I think we did cover that.
Yeah.
So, and
it should be covered by insurance. There are some variations in plans, but it's definitely worth exploring that.
Why would you use? Okay, we already have that. And I think that, can you guys see any other questions? Maybe I'm missing. Marnie, I'm so very proud of you. Just saying. So love to share that with you. Somebody's very proud of you. Okay, I do thanks to Dr. Light and Marnie. Dr. Light did my reconstruction and Marnie did my tattoos. They indeed made me feel whole, and the both have kept me feeling secure in my new body. It was so lovely.
Thank you.
Thank you for sharing that. That's really helpful. And I just want to make sure, I think that's it, guys. I think we covered it all, and we will wrap this up. And again, so grateful for this deep discussion. We're trying to bring all of this to the forefront, so it's real people behind real situations, to bringing this to light to help, especially the newly diagnosed that is beyond overwhelmed. And so they're aware and empowered. And please check out the page on the website that is a deep dive that Marnie has been so kind to share with us. And I will share this on my Reels grid, and I'm also going to put it in little sound bites everywhere. So we'll get this out there.
Fantastic.
Thank you.
And any last thoughts, guys?
No, if you have any questions that we didn't answer, please feel free to send us a message anytime.
Absolutely.
Yeah, you can tag me under the posts. I've been posting this, and I'll tag Marnie, and we'll get them answered for you. Thank you, guys.
All right. Thank you, Cynthia.
Have a good night.
You too, guys.
Bye.
Thanks so much, everyone.